Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Okay, afternoon guys. I'm sorry, it's been a bit of a short notice. We've been having a few incidents of IV Gelco infections. I know it's been a busy week and we've been in trouble with a lot of things, transition through to the electronic records from paper. But we need to know that documentation is our responsibility. We need to make sure that Gelcos, once you insert them, you need to document it. We need to check on the patient. We need to work as a team. The handover should be precise, and we need to check all these factors. We need to bring down these incidents. We can't allow these to happen. Last year we had a patient died of an infection, so we need to make sure that it doesn't happen again. So that's why I called you guys up. Let's start our day by not killing a patient. How about that?
Question 26. Now read the question.
During your stay, we will work to keep you as comfortable as possible. Unfortunately, it is unrealistic to feel zero pain after surgery. Our goal is to manage your pain at levels allowing you to participate in physical therapy and other activities. We have many tools to attack pain, starting with the peripheral nerve catheter, or PNC, inserted into your operative leg by the anesthesia team. The PNC delivers numbing medication to surround the nerve that supplies feeling to your hip or knee. We supplement the PNC with other medications as needed, either in pill or IV form. One big help in controlling your pain is to keep your new joint active by moving and working with therapy. Lying in bed too long can result in more pain as the joint grows stiff. In addition to pain medication, you will receive a 10-day supply of Lovenox.
Question 27. Now read the question.
Mr. Fernandez is a 52-year-old gentleman who was admitted to the ER last night. He lives with his wife Judy and was found down at home. They also noted he had lower extremity swelling for 5 days and was experiencing some shortness of breath and weakness. When they arrived to the emergency room, he was found to be in atrial fibrillation with a rapid ventricular rate between the 150s and 160s. After 2 boluses of diltiazem, he was started on a drip. He has 2 peripheral IVs, an 18 gauge in his left hand and an 18 gauge in his left. Both were started in the emergency room. Mr. Fernandez is a high fall risk because he fell at home. His bed alarm is on at all times and his call bell is within reach.
Mr. Fernandez, since you fell at home, you're considered a high fall risk, so we need to keep the bed alarm on at all times, okay?
Okay.
And if you need any when you get up, you need assistance, so make sure that you call when you're getting out of bed.
I will use this red button on this.
Okay, so we can count on you guys to call when you need help, right? I need to go get a report on my other patients, so I'll be back in about 20 minutes. But if you need anything, make sure you call, okay?
Okay, thank you. Sounds great.
You're welcome.
Question 28. Now read the question.
I've been a nurse for about 11 years now. I started off in cardiac, which I loved, but I was working nights and I wasn't in love with that. And then after that, the school where my kids go to school opened up, and so I was a school nurse for several years. And during that time, I just felt like I had a lot of kiddos coming to me with just a variety of issues that were more behavioral issues, such as they were maybe harming themselves in some way, or maybe having some really big anger issues that they did not really know how to cope with or deal with. And I would try to help them as best as I could and get them some community support. But I really felt like I did not have all of the answers that I personally felt like I needed, or I felt like I needed a little more training. So I ended up leaving the school and worked full-time.
Question 29. Now read the question.
It is true that athletes are specializing at a younger age than they did a decade or 2 decades ago. And that does create overuse problems with doing the same repetitive motions year-round, which is why we typically recommend for kids, hey, enjoy everything, be involved in everything, do a lot of different things. There will always be sports that one athlete will excel more at than another, but it's still healthy to be a multi-sport athlete and use different body parts and different mechanisms. And when you're growing and developing, that has a different impact on your body where you have open growth plates versus when you get older and those growth plates close. And if you're doing the same repetitive activity in a specific area with an open growth plate, you can have a problem there.
Question 30. Now read the question.
This is one of our mannequins, the SimMan Essential. He is capable of being a healthy patient. We can also program in variables on him that cause him to be unhealthy patient as well, because as we know, most of our patient population these days aren't your typical healthy patient. So when we bring the students into the room for the simulation, they are able to do an assessment of listening to heart and lungs on our mannequin. They can do a neurological evaluation of his eyes as well. Shortly thereafter, then, we go ahead and start the anesthetic procedure. So we start by giving him some oxygen by the mask. Obviously, he's still awake at this point in time. And then the students are expected to start the drug administration. And I am on a computer in a different room able to program the drugs that the students are giving. And then the mannequin responds to the drugs by either going to sleep or getting sleepy. So that the students then can carry on the procedure that has been outlined for them. What's neat about these mannequins, we can mask ventilate them, we can put special airway devices in like an endotracheal tube. If they don't happen to get the endotracheal tube in the right spot, he has a blue light that'll light up in his mouth to show them the patient is not getting enough oxygen. I'm on the control and I can make the heart rate and the blood pressure change parameters as well. So it's a learning experience for them so they can identify maybe they didn't put the endotracheal tube in the right place. He also has IV access, so we can do IV practice on him. We can give the drugs through the IV. That's typically how you do it in the anesthesia.
That is the end of Part B.